the face of rising demand, deepening inequalities and stretched resources, NHS Forth Valley's Children's Speech and Language Therapy Service chose not to accept the status quo. Instead, they asked a bold question: what if support could come where the children already are?
So we predominantly are working in schools and nurseries. We're working with children from 0 to 18 who have speech, language or communication needs, or eating, drinking and swallowing difficulties. We got to the point where we knew we just couldn't keep doing things the way we'd always done them. Our service had been set up like many health services, a traditional model of refer, assess, treat, and we were only helping children once they had been referred into the service. And we had data that told us we were only probably reaching about 10% of the children who had speech, language and communication difficulties. So that wasn't good enough. And we also knew that probably the children and young people who are most in need of our help were the ones that weren't brought to appointments.
By embedding therapists directly in schools and nurseries, the team broke down barriers to access, building trusted relationships with families and staff, and making early support feel natural, not clinical.
My job is about supporting all of the children in Forth Valley with their speech, language and communication needs. That includes supporting settings to establish small group interventions focused on specific skills, but it also includes training whole staff groups so that they can really give the intervention to the children in front of them every single day.
How did you feel that interaction went with your train tracks and your dinosaurs?
It was positive and it was definitely child-led.
I saw loads of smiles during that, so that was really nice to see.
And it was good fun.
At the heart of this transformation is a simple but powerful shift. From asking, what's wrong with this child, to what matters to this child. The team's relationship-focused approach has helped children thrive in environments where they feel safe, seen and supported.
We've really just become part of the team within the nurseries and the schools, and I think that in itself has taken away a barrier for some families who maybe didn't want to access help before.
With shorter waiting times, reduced reliance on specialist services and rising attainment across local schools, the outcomes speak for themselves. But the true measure of success is the lives changed, the children who now have a voice and the families who feel heard.
I think when a school says to us that they feel really supported, then we know we're getting something right, or a family says to us that they feel really listened to, then we're on the right tracks.
Through courage, compassion and collaboration, this service has shown what real innovation looks like: accessible, inclusive and rooted in the communities it serves.
I'm absolutely delighted that the team has got the recognition in the Tackling Health Awards for the work they've done. We asked them all to work in new and different ways, and that's not easy, but they never wavered. They were so committed because they knew this was the right thing to do.
The winner of the Innovation Award is NHS Forth Valley's Children's Speech and Language Therapy team, NHS Forth Valley.